Good morning. It's Saturday, January 12th, 2012. I'm right at about 4.5 weeks post-op, and I am feeling great. I am back to a completely normal routine, and I've got really no pain at all. All the sciatica is gone, and I'm doing about 30 minutes of walking every day, a little bit of stretching, and I really don't have any pain in the lower back. Of course, there's a little bit of stiffness there, that's just there when it's that arthritic kind of stiffness that's really minor, and it just goes away once I start stretching or walking around. So I am working hard to protect my back still. I'm not doing any twisting, not doing any lifting. I have started to bend a little bit in a very protected way. I hold on to a desk, or I support my back, or I support myself with putting a hand on a knee as I bend down using my knees. So I do a little bit of bending, no more bending than just sitting up in bed, but I make sure that the back is completely protected. And I imagine I'll be doing that for the rest of my life. But I had a visit with the doctor a couple of days ago. I'll start physical therapy in a week. I've been really antsy to just get the blood moving and start working, but I'm hesitant until I know what exercises to do. But on my own, I know that plank is okay, and I've been doing that. I've been doing a series of those. I try to hold it for a minute and then do that 3 times in a row, and that started to work things. I'm doing a few push-ups, 10 or 12 push-ups a day just to get something going. But the back is great, and as I look back on the past 4 weeks, the first 2 were really about staying out of pain on my back, minimizing, really just moving around, not in a car. You can be a passenger in a car, but I minimize that and giving the incision. You're basically cutting into muscle, and you have 2 pieces in your back in that one area, and they need to re-adhere. So those were the first 2 weeks. The third week, I probably should have been walking a little bit more. I think I got out for maybe 5 or 10 minutes a day the first week, and 10 minutes a day the second week. And the third week, I was probably out. I was back at work, so I maybe did 15 or 20 minutes 2 or 3 times that week, and that really was kind of a plateau. But week 4, I started walking 30 minutes a day and broke a little sweat, and that has made a huge difference. I'm not in a big hurry. I do want to get back to swinging a golf club. That's a big test for me, and I don't expect to do that for another month. Even just some minor short game shots. But anyway, I just want to report back in that the healing is going extremely well. I'll continue to check back in. I think that one of the key things at this stage, I've looked at some other blogs, and people talk about that balance of doing too much or too little, and I think just doing what's prescribed, really the 10 minutes a day the first week of walking, and 15 or 20 the second and third week, and really just taking your time. But I'm so pleased that I went ahead and did the surgery as quickly as I did it. It was absolutely the right thing to do. And in fact, I've talked to, you start to meet more people that have had this surgery as you let people know, and you find out what other experiences are. And it seems that there are people that live with pain for such a long time because they don't want to resort to surgery. And again, I stress that surgery isn't always the answer, but when it is the answer, and that's what you're hearing from your spine doctor, that perhaps it's, you should really consider moving forward. I'm glad that I did it so quickly. Some of the folks I've talked to, waited years, and as a result, you risk that permanent nerve damage. So it should never be taken lightly, but my experience has been extremely positive so far, and I'm just going to continue to take it easy, take it slow, and not just come back naturally. And I'll just check back in as I progress.